The NHS is a multi-billion-pound service. To help provide a world-class level of care, it spends in excess of £30 billion a year buying in goods and services, from surgical instruments, dressings and uniforms to office supplies and food.
The products that are coming into the NHS are made by people. It's really important for the NHS that it knows that it's procuring and buying product from sources that have the right standards of labour and ethical policies in place.
The supply chains which feed our National Health Service are often global, employing millions of people worldwide.
We were concerned about the potential for workers and young children to be exploited within the countries that they were working.
There's growing evidence that in some cases, workers at the bottom of those chains are paid well below a living wage. They can have poor health and a low standard of living.
For them it was business as usual, but what I saw actually shocked me.
Their basic employment rights are overlooked and their working conditions are unsafe, with devastating consequences. This man is employed in a workshop in Pakistan, which makes surgical tools for health providers worldwide.
He said I was just working in the press and I just put the piece under the press and then I don't know what happened.
Several years ago I was actually just travelling through Pakistan when one of my cousins asked me if I'd like to see how surgical instruments are made, knowing that I was a surgeon. And for them it was business as usual, and I thought, well, yes, it'd be interesting. But unfortunately the people who were making these instruments were working in terrible, cramped conditions with concerns about health and safety, and including the use of children, some as young as 7.
The British Medical Association followed the NHS supply chain back to northern Pakistan, where 10 million surgical instruments used in the UK each year are manufactured. Conditions at the biggest factories are often in line with international employment standards, but an estimated 50,000 manual labourers have little job security, benefits or union representation, and some of the high-volume work is outsourced to small, dark, backstreet workshops with shocking working conditions.
It did get me thinking that if this is what I'd found and these instruments are being used in the National Health Service, what else is being manufactured for use in healthcare under these sorts of conditions? And unfortunately we found that wherever we've looked with high throughput, disposable products in particular, there are problems. For example, there have been problems with masks and gauze swabs being made in Mexico. There have been problems with uniforms, for example, being made in India, and a number of other issues as well.
It's a similar story around the world in NHS supply chains. In Malaysia, an investigation of one of the largest global manufacturers of medical gloves reported that many employees were migrant workers who worked more than 80 hours a week and risked sexual and physical harassment. Malaysia manufactures more than 11 billion pairs of latex gloves a year, 60% of the global market volume.
I mean, these sorts of products are what we use every day, you know, surgical instruments, gauze, and it grinds somewhat with what we're trying to do. I mean, we are here to provide healthcare, and we'd like to know that the products that we're using are not being manufactured at the detriment of the health and safety or the well-being of the people who are actually making these products for us.
It's not just about goods being manufactured elsewhere. There are also concerns about the ethics of procurement in the UK.
For example, we know there are problems with migrant workers being used in nursing homes, in cleaning jobs, and on building construction sites, being paid inadequate wages and poor working conditions.
The NHS has enormous purchasing power, which means it has enormous influence. It also has a high reputational brand, so it's listened to. There are many excellent examples in the retail sector and many other sectors where companies have made a huge difference to workers' lives, improving health and safety, eliminating child labour, making sure that harassment is not happening, discrimination is not happening. And the NHS has the potential to follow along those lines. I think there's a big issue here for patients. Patients have a high demand on the NHS and high respect for the NHS. They expect quality and they expect ethics. And therefore I think they'd expect that also in the services and the products that the NHS buys as all part of that brand image of the NHS.
Most of the abuses uncovered happen a long way down the supply chain. So just how easy is it for those within the NHS to be sure that the products used are not reinforcing the problems?
We've been working on a project for nurses' uniforms for the NHS in Wales, and that meant we had to source 150,000 uniforms for our workforce. Our supplier had fabric produced in the Far East, was shipping to this country to have goods dyed, shipping back out to the Far East for the garments to be manufactured, and then back to the UK for onward distribution. We were concerned about the potential for workers and young children to be exploited within the countries that they were working, and we wanted to ensure that that didn't happen. So we asked for specific audits to be undertaken that would tease out problem areas, that would allow us to work with the companies to improve the working conditions of the staff in those areas.
Making the business case is always a challenge. The NHS tends to have long-term contracts, and we know from our experience that rewarding labour effectively, recognising rights, translates into cost efficiencies, product quality, better transparency in the supply chain and better relationships. So there's a clear cost benefit in doing that.
We've got 5 factories currently, all of whom are audited routinely, and we've worked very hard with the company to move the responsibility from us asking for the information to them, so they take on that ownership and responsibility for improvement.
There's often a feeling that if we have to pay people more, we have to look after them, but it's going to cost more and ultimately it will be a problem for us. But actually that's not true. It often ends up costing less. So really, it is a win-win situation.
The more buyers at the top of the chain who ask for higher standards, the more power the NHS has to change things at the manufacturing end. And there are key ambassadors pushing to revolutionise conditions.
NHS Supply Chain supplies over 600,000 lines into the NHS. We supply 1,000 different healthcare organisations, from primary care trusts all the way through to acute, delivering hundreds of millions of different items to trusts when they need them. We recognise that we are one small part in this, but we've got to work with our suppliers to enable them to understand their supply chains and to work with their suppliers downstream to develop their labour standards. The NHS is about people. The products that are coming into the NHS are made by people. It's really important for the NHS that it knows that it's procuring and buying product from sources that have the right standards of labour and ethical policies in place.
Many global manufacturers supplying the NHS achieve good working condition standards, like these in Mexico. But where abuses have been found, they can be widespread, affecting whole families. Kabir is 14 and has worked in the surgical instruments workshops of northern Pakistan since he was 8.
लोहे को पतला करता है पहले, यही लगी है, उसके बाद नहीं लगी।
दब गई थी बिल्कुल उंगली।
हाँ, ये पत्थर है ना, पत्थर इसकी तरह बिल्कुल पतली हो गई थी।
Just like this leaf, my hand was just crushed, just like this.
बिल्कुल पतली। Yeah. कमाएंगे तो खाएंगे ना, जब कमाना ही नहीं तो खाना कहाँ?
Making a difference to the lives of people like Kabir and many thousands of others can be as simple as asking questions at your place of work. With procurement decisions being made locally as well as at a national level, there are opportunities for many individuals to influence the system. The Ethical Procurement for Health Workbook was produced by the British Medical Association and the Ethical Trading Initiative in partnership with the Department of Health. It sets out how labour standards can be improved and provides the tools for health professionals who want to support change.
We need people to work together. It's not a single person that's going to change all of this. We need some ambassadors, perhaps. Perhaps we need people from healthcare to take on a role for doctors, nurses, other healthcare professionals to say we care about this. We need people in procurement to also care about this and to actually set the wheels in motion to change things. And we need the suppliers to start to work with their manufacturers. And if we can make that meet from end to end, then that's the only way it's really going to work.
I'm often asked whether ethical trade can make a real difference to people's lives, and we have absolutely no doubt that it can. We go to factories now where workers can talk about their rights being respected, they get paid a living wage and get paid on time. That can make a huge difference to their lives. It means their children can go to school, and that women have stopped being harassed where they might have been in previous examples. So we're absolutely convinced that engaging with companies or organisations like the NHS can make a real and direct impact on workers' lives.
This is so important. It's the core of what we do. I mean, it's one of our guiding principles that what we try to do is to minimise harm and to provide healthcare. And that should extend beyond the healthcare we provide to our patients within our National Health Service, within our hospitals, and it should extend to the global community.